Okay, so I just wanted to start out by asking, I want to gauge a little bit from the group where you all are at in terms of working with interns or having interns at your health department or your associations or your organizations. Can I just get a show of hands if you've never worked with interns or never had interns at your department or facility? Okay, great. And then everybody else who has had interns or an intern or maybe brought nursing students through on a clinical rotation, how many of you have had just only positive, fantastic, overwhelmingly ecstatic experiences? It's been the best thing ever all the time. How many of you have had tough, maybe some tough or not so great experiences bringing interns on? Honesty is good. Okay, so we have as well. And we've really been working over the last couple of years to develop a program plan for interns and how we can mentor future workforce of public health, but not just future workforce of public health, future workforce period, right? Because we have to tell our story and we have to get our message out to people that are going to be working in all of what is going to become those cross-sectoral partnerships that Public Health 3.0 is all about. Right? And so just a snapshot on the Boone County Health Department. We're located in Belvidere, Illinois, right by the Wisconsin border, sandwiched right in between Winnebago County and McHenry, and we're part of the Rockford Metropolitan Statistical Area, so that's kind of where we're located. I have 17 staff, about $1 million operating budget, never enough money in staff to get all the work done. It's just never possible on any given day. A little less than 50% of our funding comes from grants. Approximately a quarter of our funding comes from 2 local tax levies that we have, and we're serving a community of about 54,000. So when we're talking about the future of public health, I think it's been made crystal clear during this conference that we're really in a shift, maybe in our 3rd wave of public health, if you will. And I would say that 6.5 years ago when I came to the Boone County Health Department, we were pretty good at being a 2.0 health department. We had immunization clinics, we ran a really nice WIC clinic, we were out in the community doing some blood pressure screenings, and that was all great. We were doing emergency preparedness, and we were working with all your typical stakeholders, and they liked us, and it was good. And now it's time to sort of shift that model, look beyond what was our little clinic and our well and septic and restaurant inspections, and create something a little bigger, a little bit more broader scope, which is the whole concept behind the 3.0 scope of practice. So I want you to keep in mind as we're giving you some examples and talking you through sort of how we've developed our Boone County Teaching Health Department Mentorship Initiative, how that concept fits into this 3.0 expanded scope of practice. So there's the 5 dimensions that are listed in that position paper, and those will be themes throughout the presentation.
Okay. So what does it mean to reinvent your local health department, or as we're saying now, to enhance your scope of practice? Well, we've spent a lot of time looking at this, and we've boiled it down to these 3 ideas. First of all, step out from behind the curtain, or, it kind of looks like this little guy is crawling out from under the curtain. Hopefully you don't feel like that. But first of all, it is engaging the entire community, not just the healthcare community, but the entire community in the whole idea, first of all, that health is beyond not being sick. And then it's promoting the whole idea that health is everyone's responsibility. Everything we do, everything that affects our quality of life is going to affect our health. Then we want to look beyond our own walls. We've talked a lot through the last day and a half about building partnerships outside of health care specifically. We've talked about building partnerships with school districts and our policymakers, particularly policymakers, earlier this morning. And then what we've done is to go one step further. And we've talked about partnerships with colleges and universities, not just nursing schools, not just schools of public health. And last but certainly not least is setting new places at the table. This is opening the door to students who are curious about public health, students who want to learn about public health. This is not, again, not just nursing students, not just students who have a healthcare interest. This is students of all disciplines. And how does it come together? Well, Amanda's going to take a little bit more time with this, but I really wanted to draw your attention to the last two bullet points here. Considering students of all disciplines, because I'm going to give you a great example of one that was outside of what you would consider a normal discipline. And she's also going to talk about some interdisciplinary projects that are coming up. These are two of the interns that I've had since I've been at Boone County. This young lady is Sophia. Sophia is a biochem major. Sophia came to us last summer, just curious. What is public health? What do you do at a health department? Well, we threw a bunch of things at her and gave her some things to work on. And then comes up our annual, Boone County Wellness Fair and Farmers Market, which is huge. And all of us that are working on it already are wearing 6 or 8 hats, and we're thinking, ooh, we have an intern. What a great thing for Sophia to do. Well, she starts out with the deer in the headlights. I can't do that. Well, sure you can. We'll be right behind you. We're going to help. So, you know, she takes baby steps, and we're right there with her, and then the steps get bigger, and the steps get bigger, and the steps get bigger. At the end of the Farmers Market and Wellness Fair, she pulls us all together and has a full report. We had nearly 400 people. We gave out this many coupons. Our vendors said this. They've already replied to our Survey Monkey on their satisfaction with how well it went. They gave us some suggestions, blah, blah, blah. And this young woman who was deer in the headlights is running a meeting. The gentleman up in the corner is Sean. He was my MPH intern that just actually graduated. In fact, he just got married last month. He was doing this as his capstone project. I had been eyeball deep in MAP for almost a year. And Sean came in January and said, you know, I need a project. I need something I can start and something I can finish. Perfect. We work up this whole idea to let him do the local public health systems assessment, start to finish. He sets the meetings, runs the meetings, does the full facilitation, writes the report, whole business. And the beautiful thing for me is that I got to watch it happen. I got to watch all of these people that started out with our first meeting about 12 and our last meeting about 40, not just enhancing their relationship with the health department, but building relationships with each other. At the end of these 5 sessions, I'm seeing people walking out looking at calendars. You know, I've been thinking about doing this. Would you be available on Tuesday? And I got to watch this happen. So this whole idea of enhancing your health department, being a chief health strategist, going to 3.0, is not just about the partnerships with health departments, but it's taking it a step further. What does the local health department get out of it? I've given you 2 examples. There's a few more. They're endless. I think this is you now.
So whose responsibility is it to train the future public health workforce? I'm sorry, I can't hear you. Whose responsibility is it to train the future public health workforce? So are we going to sit at our health departments and say, gosh, I wish these graduates were coming out with more tangible skills and they were better prepared for the field, and I just wish that when they came on board with their brand new, you know, the ink hasn't even dried on their MPH, you know, diploma yet, and man, they're just really not cutting it. It's our responsibility. We have to invest in the future development of the leadership potential within our own field, and maybe along the way really motivate some people that were going into marketing or going into politics or going into policy development or going into public speaking to come work in public health too. Or maybe they're inspired by what they learn at the local level, and then they take that skill set with them out into the world, and public health is then infiltrated through all things that are happening in all places, right? So we have these laminated handouts. It's not like either of these images are new to anybody here, I don't think. But the wheel, the 10 essential public health services, and then also the 12 FAB domains. I can't think of a better, looking back on Sean's experience with us this past semester facilitating the local public health systems assessment, I was a little jealous. I thought, man, I wish I had had an MPH internship project like that. I would have graduated really understanding what the 10 essential services of public health were and what the heck I was supposed to be doing. I feel like maybe 2 years into my job, I'm sort of kind of barely starting to figure it out. And Sean had 4 months of facilitating 5 meetings, 2 domains each meeting, or 2 essential services each meeting, and meeting our community partners, and then really understanding all that needs to go into public health at the local level. And then talking about our system being very multi-sectoral and multidisciplinary, he really took that away as well, which was really great. Anybody have any questions? Okay. So really important to have a plan on how you want to do this, because I think that the biggest pitfall, and we were guilty of this as well, the biggest pitfall is bringing on interns for the sake of bringing on interns, or bringing on interns because you've got a lot of work to get done, that you're okay, we need this project done, we need this report written, we need this project facilitated, but then not really having sort of a clear guiding plan for how you want to see that implemented. Right? So you really need a plan. You need an internship job description. You need to assign a mentor or a supervisor who's on site who's going to do regular check-ins. So gone are the days that handing a stack of folders, something that's been sitting on somebody's desk for 9 months, that, man, we really needed to get that done and it's not done yet, and then telling the intern that they need to just go through that folder and kind of figure it out is not helpful for the interns learning, and it's not helpful for the local health department to be a good mentor, right? And so interviewing prospective students, because not all interns are going to be a good fit for your organization. So we at Boone County really treat our interns like prospective full or part-time staff members. We require an application, we require an interview, we want to hear where their interest areas are, we want to hear where they think that their professional areas for improvement might be, because then we're going to make a commitment, like Skye said, to take a timid biochem major who wants to work on her speaking and facilitation skills to the end of her project feeling comfortable running meetings with 50 stakeholders in the room. So extremely important, and we treat them like members of the team. We give them the supplies that they need to do their job. Our staff treats them like they are staff in the department, and it's really important for them to feel that their contributions are valued, because guess what? They're going to want to work harder for you and get more stuff done, and they're going to be more excited every day when they come in feeling like they're a valuable member of your team. Yes?
This is, I think your point is so well taken, that we have to convey to our, especially our leadership team, that we are responsible. There's many times when I've talked to my leadership team about interns coming in as, oh, another student, you know, that's kind of the norm of the kind of reaction that I get sometimes. Yeah. So I have to do a better job, I think, of conveying why this is so important to our health department.
I'm going to interject here with something too. I think one of the things that Amanda's really stressed is that we put them on our calendar so that everybody knows when they're going to be there. They know not just the hours for the days, but how many days a week or for how many weeks or months. So it's never a situation of someone from another area, say the front desk, walking up and saying, oh yeah, how much longer are you going to be here? Which doesn't make you feel welcome, does it? So they already know that, I have this thing that I really like Sophia, for example, to work on, and they can go on their calendar and they can see, okay, she's going to be here till the end of July or the end of August or whatever it is. So they know right then if they can give her part of the project, or if they can, maybe even just talk to her about it, because she's not going to be there for the duration. But there's never that situation of walking up and saying, yeah, okay, so how long are you going to be here? Because, come on.
So also just to clarify too, we're talking about our internship initiatives, which are students that come for either 3 months over the summer, they come for a full semester or a full year, but we also have really worked on developing our nursing school clinical rotation experience, because that can be a really stressful thing on staff. Like, oh my gosh, there's another nursing student, like I don't want an audience at this quick visit for the 4th time this month or whatever the case might be. So what we did to be able to still take high volume of nursing students through our organization is I created basically a scavenger hunt PowerPoint that I'll pass this around if you all want to see. And it's an interactive way that the nursing students learn about the 10 essential public health services. And then they're asked to get up from the little cubby where they're sitting that morning and go and track down the staff member that's responsible for whatever the program is that fits under that essential service. And then there's a series of questions that they're encouraged to ask the staff member. And so that way the workload of, there's not one staff member kind of stuck babysitting the nursing student for the morning, right? Then everybody takes an equal share in it. And there's some days that particular staff person isn't in the building. Well, that's fine, then they just move on to the next slide, because there's no way that in 4 hours they're gonna learn about all the 10 essential public health services. But whatever they take away from that is gonna be great. And our nursing students, their favorite thing, the thing we get the most exciting feedback on, man, do they love restaurant inspections, right?
Always.
And they're like, oh my gosh, they just come back and they're like, wow, you guys do all that? And we're like, yep. So, and the EH staff really likes working with the nursing students. So that helps for obvious reasons when we're talking about disease control and we're talking about outbreak investigation. We need our nurses working with our LAHPs, and this is sort of fostering that connection, right? So I'll pass this around if you guys kind of want to see how that PowerPoint is set up.
Is that something you'd be willing to upload with the slides for the?
For sure. So that's for nursing clinical rotations, and actually the Robert Wood Johnson Foundation's 10 competencies for public health nurses is also woven in there. So we lined that up with the 10 essential services to kind of drive home the whole concept of bringing it back to the nursing school experience, right?
I just have to read her second slide. This won't be death by PowerPoint.
That would be great. I handle all of our academic relations in the department, and I handle all the interns or student requests or professor requests or anything that comes through from any kind of a learning institution. And our nursing department cut off clinical rotations probably 7 or 8 years ago because of just what you said. It was too much to manage, it was too chaotic, blah, blah, blah. So I'd be interested to see this and have a conversation with our nursing manager to see if this is something she'd be willing to introduce, because it sounds like this would be more manageable for her and still get what they need out of, for the nursing students to get what they need. So she's done a few graduate level nursing students, but she cut out the clinical rotations, and I'm the one that gets the questions about why don't you take clinical rotation nurses anymore. So this might help bridge that for us. So
because who is responsible for training the future clinical workforce in this country? If we want hospitals and we want clinics to buy into population health, then who is responsible for taking those students? That's a question. Right. We have to step up and do this. Not to mention, it's kind of part of our 10 essential service plan. Workforce development is domain 8, right? We are absolutely responsible for doing that. Speaking of workforce development, I'll give you another example of a 3-month summer internship project that we did with a student last year. She was very interested in mosquito tracking. She's looking to go to Tulane's School of Public Health and do their tropical medicine or tropical public health track. And so we let her do West Nile virus trapping and testing and pulling apart of mosquito parts and sending them to the lab. But she also worked on the draft of our workforce development plan. She was not given it to do by herself. She worked on it with me and another staff member. And she sat with every single person in our building and with a copy of their old moldy job description and talked to them about what is it that you do? What in this job description still fits the bill for what you do? What are you doing that's not in here? And we went job description by job description. We revamped all of our job descriptions and we started building our workforce development plan. Meanwhile, she's learning about what different types of staff work at a local health department by talking to them and by looking at their So that was a cool project, fit nicely under one of the FAB domains, and that's been a really nice part of our accreditation journey is FAB gives you such nice bite-sized chunk projects that you can work on, and they can be started and or finished in a 3 to 4 month time frame along with the staff mentor. So we've been using that too for our internship plan. So I want to draw your attention to the handouts. Gaining staff buy-in is a thing that I hear over and over again, is getting staff on board with doing this. And so the first handout is a worksheet that we did. We presented the same concept at the IPHA conference last fall, last September. And can we get, do you need one, Craig? Yes. Okay. So this is a worksheet that we did together at that session, but this is something that you as a leader at your own health department or facility could do on your own to kind of brainstorm, because not all projects are appropriate for interns or are going to work at your organization. So this walks you through a list of questions. What are projects that you need to get done? Why? How could this be accomplished with student help? Which projects? What sorts of benefits could you achieve internally by inviting students to your health department? So this is a nice activity you could do individually as a leader, or you could maybe do at one of your senior staff meetings, or we facilitated this, and we're a small department, like I said, there's only 17 of us, so we actually facilitated this worksheet at an all-staff meeting, and we asked staff, what would be most helpful? What do you want to teach a student, but what would you also gain from getting some help in return, right? And so this helped to get staff on board, like, oh yeah, like I not only filled out a worksheet, but I handed it over to Amanda and I got to make my comments on what I thought was going to be a good contribution to the department. And then in turn, we were able to pair up prospective student interns with staff mentors at the health department, because it doesn't always need to be the highest level supervisory staff or the director of nursing or the director of health promotion or the supervisor of outreach or whatever. It can be your WIC public health nurse, or it can be your intake staff member. It doesn't have to necessarily be any one particular person in your organization that's being a mentor to the students. Every nursing student that comes through our building has to sit up at central intake, and they have to ask some of our hardest working staff in the building, what is all the crap that they have to deal with all day long from the public, right? I mean, the question doesn't say that, but that's pretty much what we want them to learn, is that you can't function without those frontline, basically trained but extremely perceptive and contributory members of your team, right? And then, so consider using this as a worksheet for yourself or at one of your senior leadership team meetings or also meetings. The second sheet is something that we developed through the trials and errors of sort of test driving our mentorship initiative. These were recruiting tips for interns. And one of the biggest things, like I said, is to be organized. So the third sheet is actually a printout of the wording that's on our website. This is our advertisement for the Boone County Teaching Health Department Mentorship Initiative. That's the third handout. So this is what we have. We direct anybody who calls or inquires about an internship to read about what is our mission and vision for mentoring students. So if that turns them off, or if they're not willing to make that kind of a commitment, then we usually don't see an application from them. They have to fill out an application. We need a resume. We want to see writing samples. We need to know at what level these students are, because MPH students come in all different skill sets, right? Depending on what school they went to, what their focus area is, how much undergraduate preparation they had in writing or research, and so we need to get a better grasp on where they're at, right? So this is how we put our message out there. There's an organized way at the bottom of our website where they can apply, and then we filter all the applications through a process where we kind of look at who we might want to bring in for an interview, and then we conduct a professional interview just like they're applying for a job. And we have a set of questions that we like to ask them so that we can figure out who might be their best staff mentor if we bring them on, and what might be projects that would continue to grow their interest coming in, but what might be things that stretch them beyond what their normal understanding is or what they think they're interested in. Yes?
So I kind of have a two-part question.
Sure.
So the first thing, this sounds really great, and I'm wondering if you all kind of have this entire process sort of written up, and if so, if you would be willing and able to share it? Because I know for my organization, we're looking to build an internship program, like a more comprehensive something, and so looking at models of how it's going well would be super helpful. So that's question one, and then question two is, this sounds like a lot, and I'm wondering in terms of staff time, if you could talk about kind of what goes in terms of staff time and what the benefit is, and you know what I mean, like how those things compare, because I think that's a large argument that we're getting in my organization. Is just like, oh, well, this is going to take so much to do all of this and interview people, and you know what I mean, like all of that. So
Sure, but isn't it an essential public health service that we train our future workforce? So it's technically part of our job description, right? We have to do it, even if it's time consuming. It does take time, and if you want to do it right and you want to do it well, it is time consuming. That's where the worksheet came in handy to identify internally what staff projects might be helpful, and then we create calendars and sort of weekly activities for interns to make sure that things line up well. And it's public health, so it never goes exactly like how we plan it. But it's a daily commitment. And so the staff mentor that is basically signing up to take on the student and the project, aware of the fact that it is a time commitment during their day. One thing that has been really beneficial for staff is it's sort of that concept of when you're learning even your own job in the professional sphere, right? You have to do some observing, then you have to do some trying out while somebody's right there with you, then you go and you fly solo for a while, and then what's the last step of solidifying your knowledge? Teaching somebody else, right? So in watching my staff explain their programs and the things that they do all day long while working on a project, and watching inquisitive students say, oh, so tell me about that. So when you go out on that home visit, then what do you do? Then staff takes a little bit more pride in what they're doing, and they're a little bit more excited about their job because they're getting positive feedback from a student who's new to it, looking at it from fresh eyes. Sometimes the student says, well, have you ever tried doing it like this? And the staff member's like, oh, no, I haven't. So we've seen some of those aha light bulb moments too. But I can give you my card and I can pass on any materials that you'd like. Yes?
Do you require the same applications from individuals that are applying for internships or applying for jobs? And do you also ask them, the ones that are applying for jobs at the health department, writing samples as well?
For staff and for interns, it's very similar. The questions are slightly tweaked in the interview to focus a little more on sort of their academic preparation and where they're at in the process. But the interview questions are very similar to a job interview that we would conduct, and the application is very similar as well. Yeah.
Maybe if I can add to that, we kind of review their resume too to kind of help them tweak that because we do the interview too. I mean, it's good training for them. Just interview them. I've never done that.
Yes, we actually.
And for some of our staff that may be new in management and supervisory, it's good for them as well. So it kind of works.
Okay. The only thing I want to add to that is that one of the things that we also emphasize is don't be afraid to turn people down. Obviously, do it nicely, but just because someone walks in your door doesn't mean you accept them, because not everyone's a fit. And because they're going to be with you for a period of time, you want them to be able to engage with your staff, and you want your staff to be able to engage with them just as you would with full-timers.
I do the internship piece at our office, but I also teach adjunct at SIUE. And I actually just taught the professionalism and public health class. It's the only program I know of, the undergrad public health class that I'm familiar with, that we have. We dedicate an entire semester on teaching them professionalism in the field. And I got short stick and got to do it this semester, but it's been great because I had 54 students, and I told them, if you don't learn anything in this class, I want to see you grow from that of a student to that of a professional. Yes. And that was their final exam, was to write a one-page paper on how did you grow more as a professional this semester. I said, don't tell me it was my lecture, because I only did 3 of them, so you know what I mean? Like, that were content-based. It was all like, how do you find a job? How do you dress for an interview? All that kind of stuff. So one thing, and I've got a question about this. So since I have a close relationship with SIUE, and I'm an alum of SLU, and I am really close with faculty at WashU because they were my faculty at SLU, so I'm connected to all 3. So if I get applicants for interns or for jobs from any of those 3, it's a quick phone call for me to say, do you know this student? How are they academically? How's their attitude? How's their production? And I tend to give a little more preference to students who who I've got a relationship with their professors, and I can really find out what they're like, because I only can handle 2 interns a semester, plus try to keep my own workload going, so I have to manage that, and then as well as try to figure out if we've got placement for someone somewhere else in the department, because now I'm also at the stage of I'm mentoring staff and other supervisors on how to be an internship preceptor, because they haven't done it, so I have to teach them how to do it as well. So I only take 2, and I'm very particular about who I take, whether they're grad or undergrad, because I don't know if you emphasize this or not, but I'm like, this is an internship at a county health department, and those are hard to get. And we're in the suburbs of a large city, and we're ran by the county government. So if I put someone out there, set them loose, like they're representing not just our department, but our county board, and because that is the Board of Health, our county chairman's the chairman of the Board of Health. So I was kind of really weigh that into the interview and into my selection process too, because if they can't, you know, hold the weight of that, then they don't deserve to have us on their resume either. Because I'm not going to give them something like, go file my papers. I'm going to give them a real project to do. So I need to make sure that they can stand up and earn that. I always tell them, are you willing and ready to earn this position if it's given to you? So I don't know if you guys have that same kind of emphasis with your departments or not, but that's something I'm kind of particular with. And so I tend to go more with, like I've had probably 12 different internship inquiries this semester for summer. And I already took 2, so I've got like 6 more that have come in that I have to decline, but the 2 I chose are 2 students who I actually work with ESG, with the honors program, and they were in my class. I know what kind of work. Sure. And they volunteer at our department. They become MRC volunteers, they show up and help with things. I already know that they can show up, dress appropriately, you know, talk to whoever I've already made them talk to, raise money for whatever we've had to do. You know what I mean? Like I want to help them in their career because I know they're going to give us something versus some of these other ones I get that I don't know these people, or you know what I mean? I feel like they just blanket email all the health departments. Like, why do you want to be here at this point?
Sure.
Kind of as a follow-up, so this is very much from the health department perspective. What do you require from the academic centers? You know, I mean, oftentimes, you know, they've got advisors and all of this that they're working through. So do you require a master educational agreement with the institution? Do you require them to validate the learning objective? Because that's the other disconnect we often have. So I was curious about how you manage that.
So some of our interns come with formal academic partnerships. Northern Illinois University is an example of a school that we have a formal academic partnership with. We're working on one right now with Beloit College. It's not solidified yet. We've taken students under informal internships in the sense that they're not necessarily coming with specific learning objectives or a requirement for a paper at the end that meets certain competencies for their degree program. But if they don't come with that, then that's something that we develop internally with them. So that there are goals, there are objectives, there are mile markers in their learning process, which does put the onus on us. It is time consuming to put that stuff together, but once some of it is templated, it's very easy to then use again with a future intern.
I guess the remark would be to making the academic institutions equal in that partnership.
Yes.
Because oftentimes you get a call at the end that look great, and you're like, yeah.
For sure.
You're not reading any of the reports we're sending.
You have
one more. I just had one more brief thing to say, but I wanted to. Yeah.
So your agreement with the university, and you said you're working on one with Beloit, is that something you approach them to have an agreement with the university for internships, or how did that work?
Well, so with some of our partnerships, we've been approached, and then with other partnerships, we've done the approaching.
Because you're making me think, like all of our good interns, when we're done with year 1, we wish they were year 2. So like you know, you get them trained and they leave you. It would be really interesting to talk with local institutions about a 2-year deal. For sure.
Something we did with SIUE, because there's just be the internship part of it, the agreement, because we can't, because of liability with the county government, we can't take a student of any kind unless we've got a formal MOU with that university, and they have to be there for a specific academic reason. Even if it's a project, we have to have an MOU. It's just for liability for our end. But with SIUE, I talked with the department chair many years ago, because the problem kept coming up that people wanted to do service learning with us. They wanted to do these kind of independent project things that were tied to a class, but weren't an internship. And so they actually expanded their MOU for, not just for us, but for everybody, to cover like the 3 years that they would be in that discipline. That way, anytime one of the students from that program came to us during that time period, if they could show it was linked to a professor or a class or some kind of a learning experience, then we could take them. And the liability would still be on the university instead of on us. So that was something we requested of the university to help expand it. And we haven't done it with any of the other ones, but we did it with them because they're in our county. And we get so many students that need, like you said, individual projects. So I don't know, I'm not afraid to ask, so.
Yeah, no, for sure. And we have paperwork that they have to fill out before they even start. We have confidentiality paperwork, we have HIPAA paperwork, we have code of conduct in our office paperwork, and that's where it comes into, they're not a degree professional yet, but all of our full-time workforce are, either degree professionals or, technical staff, and they've all had to fill out those same professional codes of conduct. So we do feel that that helps to cover us as well. The only other brief thing I just really quick wanted to say is the transition to sort of chief health strategist and cross-sector collaboration with internships. Our new endeavor for this summer is bringing on interns that are not doing necessarily departmental projects for us, but they are specifically working on a cross-sectoral partnership in Boone County. So an example is we have a student who's coming on board for the summer, and her whole internship is going to be about food insecurity. So she's going to be working with our Boone County Hunger Coalition. She's going to shadow not only my staff, but staff of the coalition members. So she'll be at our local food pantry. She's going to go to the Community Action Agency, City of Rockford. She's going to be shadowing the professionals that are dealing with food insecurity concerns in Boone County, attending our coalition meetings, and then helping us to form the beginnings of our food security plan for Boone County. So that's not a health department plan, that is a community collaboration and a community plan. We're also bringing on an intern to work on the concept of fractured work because our health department is participating with UIC's Healthy Work collaborative over the summer, and that intern will be attending all of those sessions, and that is a shadowing opportunity at one of our economic development organizations, at our city council meetings, and then with one of our county board members who's been working on economic development in the community. And she'll be working on some of the issues related to the public health impacts of a fractured workplace. So those are some examples of how we're taking it outside of our own walls and really embracing sort of this public health 3.0 concept with the interns. So, yeah.